name is Poonam Shirsagar. I am from Kokilaban Dhirubhai Ambani College of Nursing. I came here to attend the ICMR suicide. Topic is suicide session. So I learned from the previous session by Dr. K.C. Chawda and Jaya Konuvila is that what is the suicide ratio among the various professions, and what is the impact of that suicide tendency among the various professions, and how so many neurotransmitters will help us to identify the suicidal tendency in the children. That's it. Thank you.
Good afternoon. Myself Nilofer, second year MSc Nursing student from PD Hinduja College of Nursing. From Chanu ma'am's lecture, I have learned about various new terminologies related to suicide, like cyber suicide, anniversary suicide, and the positive factors that are responsible for suicide. Also the verbals and non-verbal signs which will help us to identify the victims for suicide. These all things will not only help me in the day-to-day professional life but also in my personal and social life.
Yeah, start.
I am Jyoti D'Souza, and the talk on suicide and risk assessment created an awareness of the suicide rate in India and the world, and how rampant it is in the present world. There is so much of stress, and majority affected are the students, the youth, who can't cope with today's problems and stress. But with the awareness and help from the counseling and how suicides can be averted for a mentally healthy living in society, we are happy to know that there are so many facilities available for all of us, and we can be of help to the country in every way, whichever way we can help the country. These points have brought an awareness into society and into all of us. Thank you.
Session by Avinash sir was very nice, and I liked that session. And we were not aware about this rehabilitation and all about depression. We come across with so many nurses who tells that I have this problem, I have this tension, but we never took it this much serious. Now we came to know that there is prevention like primary, secondary and tertiary. So now when I think back, I can make out that it was already reached to the level of secondary prevention. So we have to diagnose them as soon as possible, because we come across with so many nurses, they tell that. So I was doing so much nice in my previous career, otherwise in my high school and all, and I wanted to become a nurse, and when I came here I am not up to the mark. So now I came to know what they are facing and what is their problems are. And Avinash sir was very so we would like to conduct like this monthly by some some classes on stress management, or to assess the stress level of our nurses too. And we will try to implicate in our hospital also this.
I am Govindamal. I am a nurse patient counselor from Apollo Hospital of Navi Mumbai. First of all, I thank my nursing director, Ms. Neha Vaidya, who gave me this opportunity to attend this conference. I really enjoyed this conference because the way of presentation, it's not apart from other workshop, it is really different the way they are present very well. Like role play and now the panel discussion, everything is enjoyed. I enjoyed a lot. The only thing I have to discuss, that role play I enjoyed a lot, because the girls who all are put their effort, it is really awesome. And the girls, the choreography as well as the participants, the way of dubbing and the lip movement, everything perfect. I enjoyed that, and it gave me that one beautiful idea. In our hospital we can use this idea for any workshops and all. Thank you so much. Thank you.
Trustee Elsa Kuren from Hinduja Hospital. So the panel discussion, it had many questions and started with the signs and symptoms, identifying the usual and unusual behavior among the affected people, and then it went to the strategies and the therapies that has been conducted from the primary level to the secondary and the tertiary level, and about the stigma of depression or any other psychiatric disorders that people are being affected, and also the constraints of the depressed people, and how we can overcome the constraint of it by two of the ma'ams and the sirs out there. So I think it's been a very good discussion for the audience. We have gained many of the information, also many therapies, the ways and how you can differentiate between the usual and unusual person, and help and getting empathized to their situation, and recognizing them with various problems, and helping or guiding them, or showing them a way where to go and get it treated, and make them like all of us. This is a very good session.
Hello, my name is Shraddha Sankurkar, and I'm a psychologist and also the founder director of Mind Matters and School of Emotional Intelligence. I attended this particular seminar, and I feel that the initiative taken by the college has really done a wonderful job, and it's worth appreciating. It's high time that when we quote health, it needs to also include mental health besides physiological health, basically. The suicide rates are on increase, and it's very important that such awareness programs need to be more on the whole. I feel that the event certainly has sowed seeds of suicide prevention awareness, which I believe will help the delegates apply the information shared by the speakers in a way that will help themselves and society. Thank you, and all the best to the college.